I have the best results with lupus and rheumatoid arthritis. And one of the amazing rheumatoid diseases that we see are patients with dermatomyositis. Many scientists think that the patient's T cells inappropriately recognize their muscle cell antigens as foreign and attack this tissue, causing diffuse or focal muscle degeneration. And these are muscle fibers, and here are immune cells really eating up the muscle. It's a type of autoimmune disease. The prognosis of dermatomyositis, 20% die in the first year in extreme cases, 2 to several years survival in chronic forms, and many of these people have some type of cancer. Mr. WJ was an extreme case. A 48-year-old rancher from New Mexico. I first saw him in October 2007. I did CAT scans and they did not show cancer. His problem started in fall of 2005 with progressive weakness and a very serious skin condition. In many areas of his skin, the skin was actually peeling off. He was helped in by his sons. He could hardly even walk. The rheumatologists put him on prednisone, Celsep, Imuran, methotrexate, Remicade, all drugs that interfered with normal immunity. But with these drugs, he kept getting sicker, his teeth fell out, kept losing muscle, profound weakness, severe anemia. His doctors told him his condition was terminal. He would die within the year. His CK, his creatinine kinase, which is a measure of muscle breakdown, when we first saw him was 25/73. And his pain scale was 10. All of these immune cells were gobbling up his muscle tissue. This was in October 2007. By December, 3 months later, on the lipoic acid low-dose naltrexone program and off-standard drugs, his creatinine kinase fell to 573 and his pain scale went from 10 to 2. He started feeling normal, went back to work, and he started putting muscle on again. October 2008, 12 months later, he is free of pain. His creatinine kinase is normal. The rash is completely gone, and he feels strong and normal. Rheumatoid arthritis. Well, you all know you've all seen people with these manifestations of rheumatoid arthritis. Mrs. A.E., 47-year-old radiological technician, diagnosis severe rheumatoid arthritis plus systemic lupus. She was perfectly normal until she had dental implants in 1999. And soon after that, she developed some type of a severe autoimmune disease. So she has this mixed collagen disease. She presented to our office in July of 2005. Her rheumatoid factor was 969, which is very high. Normal is about 13 or less. And her anti-nuclear antibodies were 1,446. She wanted to try something less toxic. She was in severe pain. She was on Enbrel, Areva, cost her $1,800 a month, and she was having terrible results. She kept getting sicker with the expensive drugs. She was previously treated for many years with methotrexate, prednisone, with severe bone loss and anemia. She had mouth sores, anemia, bone loss, abnormal liver function tests. recurrent viral infections, chronic fatigue, feeling sick most of the time. This was with the standard treatment. We suggested that she continue with her rheumatologist on a regular basis, just so he could follow her. We started on low-dose naltrexone, alpha-lipoic acid, intravenously twice a week in a healthy lifestyle, and we weaned her off all of her standard drugs. By June 2006, 11 months later, her pain index went from 10 to 2. Patient said she feels almost normal. Her rheumatoid factor went from 969 to 131. Her anti-nuclear antibody went from 1446 to 1178. Today, 39 months later, very little joint pain, an ALA and low-dose naltrexone and naproxen. Feels practically normal. Let me say that when Mrs. A.E. Started feeling better, then she went through a period of severe emotional stress, and she had an exacerbation of her autoimmune disease. And she went back to her rheumatologist and asked him to try Humira, which is a biological response modifier. Very soon afterwards, she developed a fever of unknown origin. Well, it was from the Humira. And she developed gigantic lymph nodes in her neck and groin. I suspected a B-cell lymphoma, and I sent her to another oncologist who I work with all of the time. And he did a biopsy, and it did not show a full-blown lymphoma. And he said, why don't you go back on the low-dose naltrexone intravenous lipoic acid treatment, which he did. And today, very little joint pain. Her lymph nodes cannot be palpated, and she feels practically normal. These are just a few random rheumatoid arthritis patients that I just pulled charts out on them, 8 of about 100. These aren't the best cases, they're just random people. One person went from 600, rheumatoid factor from 600 to 54, 358 to 70. Mrs. TE or AE went from 969 to 131. Mrs. PS from 1926 to 10. TM 361 to 48. With rheumatoid arthritis, we just have remarkable results. Every time we have a rheumatoid arthritis patient, I'm very pleasantly surprised. In most cases, we've had some failures. We have many systemic lupus patients. As you know, with lupus, you have these high anti-nuclear antibodies. The body starts attacking its own tissue. We have pleural effusions when the immune system attacks the membranes of the lung, heart problems, kidney disease, arthritis. They often have this rash on their cheeks. It's called a butterfly rash or a malar rash. And this is a glomerulus of a kidney, and the kidney's often attacked. Once more, this is just a group of patients with their anti-nuclear antibodies. When I first saw them, this lady was 1280. Within 6 months, went down to 269, 160 to 0, 1182 to 11. We just have very, very exciting results with lupus.